Good day everyone. Today, we will be presenting to you our presentation in FlexPen and tuberculin syringes prepared by Group 2 of Block B. The outline of the presentation will be the description of the FlexPen and tuberculin syringes, its parts, application, and procedure. We will also present our chosen new medical device. So let us begin with the description of FlexPen. FlexPen is a prefilled dial 8-dose color-coded insulin pen that is able to deliver from 1 to 60 units of Novirapid in increments of 1 unit. It is also designed to be used with NovoFine disposable needles up to a length of 8 micrometers. Insulin is a hormone that works by lowering levels of glucose in the blood. Thus, we utilize FlexPen to decrease glucose levels. Moreover, the NovoFine are insulin needles that will be used together with FlexPen. NovoFine is worked by administering insulin into the body, and it is an injecting insulin that would help to control the blood glucose level of the patient. So, FlexPen is an insulin pen that is used with NovoFine, a disposable needle that would help to control the level of glucose in the blood. As you see on the image, the green label is for basal or long-acting insulin, while the orange label is used for bolus. The next slide are the parts of FlexPen. Pen cap. Pen cap is used to protect the medication inside, so it is important to use pen cap to cover the pen when it is not used to prevent contamination. Rubber seal. Rubber seal is a connection of pen needle and body of the pen. This is where you will insert the disposable needle that will be used to inject the insulin. Insulin reservoir. It is used to hold the insulin, or this is where the insulin was placed. The insulin inside can be seen and monitored through a clear plastic area. Insulin reservoir is very useful to see how much insulin is left in the pen. Label. This part, we can see the type of insulin and the expiration date, and it is where also the brand name indicated. On the edges of the pen are the dose selector, dose window, and injection button. Dose selector is the dial right dose. It is where we can see the units that have been selected to inject the insulin. It is very important to see how many units you have selected before injecting the insulin to prevent medication error. Dose window. It shows the number of units of insulin selected. The arrow pointing to the number in the middle of the dose window indicates the number of insulin units that will be injected. And lastly, injection button. Injection button is a button that is pressed down to administer the injection. Now we go on to the specific parts of the needle. First one is the outer needle cap. This would cover the needle. This would protect the user from accidental needle stick injuries. Inner needle cap. It is used to keep the needle clean. It is very important to keep it clean to prevent the patient in danger of contracting some diseases such as hepatitis C, hepatitis B, and HIV. Needle. Mainly, it is used to inject the insulin to the patient. And lastly, the protective tube. This helps the needle clean. It needs to remove this before attaching the needle to the insulin pen. The application of the FlexPen is for the people with diabetes. They use this kind of pens to inject insulin, a vital hormone for people who have diabetes. It allows more simple, accurate, and convenient delivery. Novolac FlexPen is not approved use by anyone younger than 2 years old and should not be used to treat type 2 diabetes in a child of any age. For your information, diabetes mellitus, a condition where your pancreas does not produce enough insulin to control your blood sugar or glucose level. Extra insulin is therefore needed. This device lowers your blood sugar level after injection. When injected under your skin, in which it has a faster onset of action than soluble human insulin. It takes effect within 10 to 20 minutes. Usually, the maximum effect will occur between 1 to 3 hours after injection, and the effect may last for up to 5 hours. As with all insulins, the duration of action will vary according to the dose, injection site, blood flow, temperature, and level of physical activity. Due to its shorter duration of action, FlexPen has a lower risk of causing nocturnal hypoglycemic episodes. Proper procedure in using FlexPen or other insulin pens. 1. Prepare the pen. 2. Attach new needle. 3. Check the insulin flow. 4. Dial insulin dose. 5. Inject the insulin. And lastly, remove the needle and store the pen. The following slide will explain clearly each steps. So, first step that we will do is to prepare the pen. Check the name and colored label of your pen to make sure that it contains the correct type of insulin. Pull off the pen cap. Second step is to attach a new needle. Remove the protective tab from a new needle. Screw the needle straight and tightly onto your pen. Pull off both needle caps, then keep the big outer needle cap. Third step, check the insulin flow. Turn the dose selector to select 2 units. Press the push button all the way in. The dose selector returns to 0. A drop of insulin should appear at the needle tip. Then the fourth step is dial insulin dose. Check that the dose selector is set at 0. Turn the dose selector to select the number of units you need to inject. You can turn the dose selector up or down to adjust the dose. Then it is ready now to inject the insulin. Insert the needle onto your skin. Press the push button all the way in until 0 lines up with the pointer. The needle must remain under the skin for at least 6 seconds. This will ensure that the full dose has been injected. After using it, safely remove the needle. Lead the needle into the big outer needle cap. When the needle is covered, carefully push the big outer needle cap completely on. Unscrew the needle and dispose of it carefully. Then put the pen cap back on. These are the additional informations that it is important to know in order to avoid medication errors. Do not use if the patient is allergic to insulin or any other ingredient present. So, as a medical expert, it is important to know the background of the patient. The best thing to do is to ask the patient if he or she has allergy to insulin or any other ingredient present. Do not use if the FlexPen is dropped or damaged because there is a risk of insulin leakage. It is important to return it to the pharmacist for the proper disposal. And do not use if it does not appear colorless or clear. And lastly, do not use if it has not been stored correctly because storage affects the concentration of the medication. It is also important to remember to check the label to ensure that it is the right type of insulin. Always use a new needle for every administration to avoid contamination. And do not share the device. And lastly, remember to keep an open device in the refrigerator until first use.
Tuberculin syringes are devices used to measure and deliver specific amount of liquid through the needle. They are used for subcutaneous or intradermal injections of medicines, vaccines, or other substances. The tuberculin syringes are commonly used for tuberculosis testing or TB test. Tuberculin, a purified protein derivative, is a glycerol extract of the tubercle bacillus used for tuberculin PPD skin test. It involves injecting a small amount of substance called, like what I've said, tuberculin into the skin of your forearm through subcutaneous or intradermal injections. They are also graduated and can contain up to 1 cc or 1 ml of liquid. They are sterile and latex-free and come with a variety of needles, including attached short, point gauge needles or a lower lock or slip needle hub. A standard dose of tuberculin is injected between the layers of the skin or subcutaneous and intradermal. This method is called Mantoux technique and is typically performed on the inner forearm and creates a bubble of liquid that is eventually absorbed by the body. The tuberculin syringes has its four parts, which is the plunger, barrel, needle, and cup. The cup in tuberculin syringes is a part of the syringe designed to keep the medication or material inside the syringe from curing or contamination. Because without cup, there's a possibility that the substance inside the tuberculin syringe can be contaminated. And when contaminated, the substance cannot be used anymore. So the next to the needle is the tip, where it is located at the end of the syringe that holds the needle. The needle's function is to be injected. So the point or the tips allows the needle to exert pressure on the surface to be pierced. Next part is the barrel. It is part of the tuberculin syringes, where it is a hollow cylinder that holds the medication, and it has a calibrations or the markings on its outer surface. The barrel is where you can see the numbers or the cc or the ml on the syringes and the substance inside the syringe. The medicines or the substances or the medications are stored in the barrel until it is injected. Next is the plunger. The plunger is a long, thin rod that fits snugly inside the barrel of the syringe. It is easily slides up and down to either draw the insulin into the barrel or push the insulin out of the barrel through the needle. And when you push the flange is a part of the syringe that you will touch, which is it is the parts that bears the load of whatever is pushing the plunger. This is usually pushed by the thumb. When using a syringe, you will push the flange, and then the substance or the medicines inside the barrel will be passed through the needle and then to the skin intradermally or subcutaneously. The plunger and the flange are always together because when the flange is not there or it is broken and the only thing is the plunger, the syringe cannot be used because you can push the plunger without the flange, or maybe if the plunger are not in there, it is broken, you cannot use the syringe. Now, we're done with the parts of the tuberculin syringes, and we're going to tackle now the parts of the needle, wherein the first part of the needle is the lumen. The lumen is the hollow bore of the needle shaft. If you look at your needle, you will see a hole or the very top point of the needle, wherein when you push the flange, you can see the water or substances or medicines comes out in that part. The next is the bevel. A bevel is the angled surface formed on the tube when sharpened to make a needle point. When using a needle, the bevel should point out upwards for an injection to allow for a better administration of the medication. And the next part is the shaft. The shaft is the longer or long slender stem of the needle that is beveled at one end to form a point. As you can see, when you have a syringe or tuberculin syringe, the long part of the needle, it is called shaft. And it is the one you angled when injecting a patient or when administering a medicine or medication. And the next is the hub. The hub is at one end of the needle and is the part that attached to the syringe. It is at the bottom of the needle or the plastic that you can see surrounds the needle. And the next is the extended cannula. The extended cannula, it is where then you are injected or when in the confine, and it will be the one who will be left on your arms, or it will be the one that will remain. We're done with the parts of the tuberculin syringes and the parts of the needles. We're going to tackle now the application of the tuberculin syringes and the proper procedure in using the tuberculin syringes. The first one is to locate and clean the injection site. When injecting a tuberculin or any syringes on the patients, make sure to place the forearm palm up on a firm and well-lit surface of the patient, and select an area that free of barriers such as scars, sores, and veins to placing and reading. When finding a site to be injected, look for the veins that can be injected. And when finally that you see the site or the veins, clean it with the alcohol. The second step is to prepare the tuberculin syringe. When preparing the tuberculin syringe, make sure to check the expiry date on the vial and ensure vial contains tuberculin PPDS. We can't afford to make any errors or mistakes in administering these drugs. And use a single-dose tuberculin syringe with a short 1/4 to 1/2 inch 27-gauge needle with a short bevel. When finally you prepare the tuberculin syringe, clean the top of the vial with a sterile swab and fill the syringe with 0.1 ml tuberculin that you're going to use when administering the drugs. Preparing the tuberculin syringe, now we're going to inject the tuberculin. In injecting the tuberculin, insert the needle slowly. Don't insert it as you like it to be inserted. Insert it slowly. Bevel up at an angle of 5 to 15 degrees, and the needle bevel should be visible just below the skin surface. Don't insert or inject all the part of the needles on the skin of the patient because it should be visible below the skin surface, the needle of the bevel. After injecting the tuberculin or the drugs, we're now going to check the injection site. A flat intradermal well of 8 to 10 diameter should appear. If not, repeat the injection at the site at least 5 cm or 2 inches away from the original site. It means when there is no flat intradermal well of 8 to 10 diameter that appears, you should repeat the process, but don't inject the tuberculin or the syringe syringe on the same spot. You need to inject the tuberculin or the injection at least 5 cm or 2 inches away from the original site. Why? Because if you injected the syringe on the same spot, there will be no also any result, because at first place you injected it and there's no result, so you need to adjust 5 cm to 2 inches away from the original site to see if there's any reaction or any result. The last part or the last step is to record all the information required. After you check the injection site, if there's any reaction or any result, you need to record all the information. If there's any a flat intradermal wale that 8 to 10 diameter, or in your second attempt there's no result also, you need to record all the information because it will be needed on the assessment of the patient. Remember, rotate the injection sites and do not inject medicine in the same spot twice in a row. As I've said earlier, if there's no result or if there's no flat that appears, move or adjust 2 inch away or 5 cm. And clean the specific site with an alcohol swab. If you're going to re-inject or repeat the procedure, clean also the site that you choose, on the site where it is the 2 inches away. Clean it also before injecting the injection. And and if there's severe pain, redness, swelling, or warmth of the drainage after the injection or being injected, it means there's an infection in the patient.
New medical device research. Surgical mesh with antibiotic coating with a brand name known as Phasix ST mesh, which comprise of fully resorbable, biologically derived polyfluorohydroxybutyrate monofilament that is connected with polyglycolic acid and coated with a resorbable hydrogel layer on the visceral side of the mesh. Mesh bacterial colonization or infection remains a critical issue in complex subventral hernia repair. Despite the recent emergence of biologic meshes, current strategies to prevent and treat mesh infections are largely ineffective, often leading to device failure and subsequent explanation along with associated cause and effect on patient welfare. Unacceptably high rates of morbidity and hernia recurrence following mesh infection highlight the need for innovation in the area of hernia repair for the complex patient. One recent strategy to address such shortcomings is local antibiosis in the form of polymer coating applied to the mesh itself. Current literature regarding the use of antibiotic-coated hernia mesh is limited, but does illustrate the ability of this device to inhibit bacterial growth and prevent mesh infection in both in vitro and vivo studies. Although there is a paucity of literature regarding long-term clinical efficacy, this provides opportunity for further inquiry into a promising new development to combat mesh infective complications. So in this slide, I will present to you on how to counsel a patient in using this kind of device. Number 1, it should not be used on patients with known sensitivity to porcine foods. Number 2, do not use in patients with allergy, history of allergy or hypersensitivity to tetracyclines or rifamycins or other components in the device. Do not apply it to pregnant or nursing women. The use of this product in patients with compromised hepatic function. This is intended for single patient one-time use only. After use, handle and dispose of all unused product and packaging in unity with accepted medical practice. Make sure the prosthesis is positioned correctly. The uncoated mesh sides should not be placed against the bowel. After initial hernia defect repair, the Phasix ST mesh can be implanted intra-abdominal or preperitoneal. As per adverse reactions, Phasix ST mesh elicited a modest tissue reactivity in preclinical tests, similar to a foreign body reactivity. As the mesh was rendered inert, the tissue response subsided.
What is the function of Phasix ST mesh? The mesh is recommended for the use in the reinforcement of soft tissue where weaknesses exist, in procedures involving soft tissue repair, such as for the repair of hernias, including hiatal hernias. Hernias means a tear in your muscle or tissue that allows part of your insides to bulge out. It is a medical device that supports damaged tissue and around hernias as it heals. Surgeons place mesh across the area surrounding the hernia, attacking it with the stitches, staples, or glue. Pores in the mesh allows the tissue to grow into the device. Benefits of Phasix ST mesh is first, low-profile design facilitates trochlear deployment during laparoscopic placement. Laparoscopic placement is when operating without opening the stomach. Next is handles, sutures, and fixates like a synthetic mesh. Third, inhibits postoperative infections effectively over a long period without any cytotoxic effects. This could be one strategy to prevent infections after surgical operations. And fourth is it induces a desired host response, integrates with surrounding tissues, and demonstrates sufficient mechanical properties for abdominal wall stabilization. Last is it is envisioned for implantation to reinforce the soft tissue where weakness occurs and for surgical repair or damage or broken tissue, including abdominal plastic and reconstructive surgery. Muscle flap reinforcement, hernia repair including abdominal, inguinal, femoral, sacral, incisional hernias, umbilical, and diaphragmatic. Phasix ST mesh has been designed to provide the repair strength of a synthetic mesh and remolding characteristic of biologic. And it supports functional healing and strong repair while minimizing tissue damages.
This is the end of our presentation about FlexPen, tuberculin syringes, and surgical mesh with antibiotic coating. Thank you for listening.